Welcome back. Health and wellness. We talk about it a lot on this show by design, but how many of us actually walk the walk from getting enough rest to important health screenings? All of it plays a part in maintaining a healthy mind, body, and spirit.
I'm Dr. Corey Hebert, Chief Medical Editor for BNC, and all this month we are challenging Black and brown people to be well. During this month, we're focusing on 4 key areas of health: cancer awareness and prevention.
There is no woman who's too young for breast cancer if she has breasts.
Studies have shown that Black patients get less recommendations from their primary care doctors than their white counterparts.
Wellness.
We have been in full-on sleep deprivation, Black people in this culture, since plantation labor.
You better listen to your body, and when your body says rest, do it.
Sickle cell awareness.
What we hope will happen is that after the treatment, it will be a permanent change in their hematopoietic stem cells. That is, there would be enough of the healthy hemoglobin being made from red blood cells derived from those corrected stem cells to actually permanently correct the disorder.
Black maternal health.
Some of the research I've done has shown that racial concordance matters, meaning that when a Black family, a Black infant is cared for by a Black physician, they have better outcomes.
It's unacceptable for anyone to die in childbirth, especially in 2021 with all the technological advancements that we have.
Be well, all this month on BNC.
I want to say this may be the most important work this network has done to date. We're so used to being treated like trash and treated like we can be thrown out like trash, that we use words that are appropriate, like health disparity, right? And it's accurate. But it kind of dilutes what's really going on here. And that's why I say racism is so gross. It infects everything, Mike. Why on earth would beautiful, educated, and I really don't care if you have a high school diploma, a GED, or nothing, no one should have to die in this country at a rate of 40% more than white women, breast cancer. It's unseemly. It's unseemly. So this network is not just an opportunity to shout out I'm Black and I'm proud and all the things that we can and should be doing. This is essential. They talked about essential workers during the pandemic. BNC is essential. This must not continue. And I love this effort, but it's so triggering and I'm so upset, and we need to, and you got to help coach me to turn that into this positive outreach that we're doing here.
But I think that's part of it too, is like, our mental health as well. So in addition to everything that we're educating people on, which we should, because we hear, like you said, so many disparities, disproportionate amount of issues that we have when it comes to every health concern that we have in this country. We just had Dr. Frida Fisher on talking about kidney failure and how that affects us. We're talking about how COVID-19 disproportionately affects us so much. We have got to continue the education process and to be the advocates that so many of us in the Black community need when it comes to pushing to ensure that we have the proper diagnosis and the right type of treatment. And how many times have you heard that, where we don't have the proper diagnosis because they feel like our pain tolerance is a little bit higher, or they just don't care, or the health insurance isn't there, and on top of that, maybe they just don't treat it. And yes, there is a little bit of it that is soaked in racism, but there's also the education part of it for us as well, because we can look at what they're doing, and they're doing a lot, but we internalize it as well, because we know so many of us sometimes, especially Black men, and I'm speaking to my brothers out there, we need to do a better job of making sure that we go to the hospital. We're tough, we're strong, we can take a lot of pain, we're very resilient, but at the same time, we need to get the help when the help is out there, and it's necessary for us to get the help and not say, hey, you know what, I can tough this out. We got to stop manning up, because when we continue to man up, sooner or later, if it's affecting you that severely, whether it's mentally or physically, it's going to be man down. And when I say man down, it's going to be 6 feet down.
Yeah.
So we here at BNC are doing the right thing, and I love that we're doing this.
I do too, and I think that you're right. Every man, every woman, every black and brown person has to take responsibility for their own health care. We're here to support you in that effort. But I also think that we have to be clear, be deprogrammed, unlearn what you've been told, be disrespectful if you have to. You're not going to tell me about my body and not allow a follow-up. I'm going to ask what I need to ask, and I'm going to keep asking until I get it right. And then I'm going to demand. That's the way I treat healthcare. Do you know how many times I've been told in my life to let it go? I'm not going to let it go. I'm not going to let it go. There is something going on here that is desperate. It is a matter of life and death. And we have a right to question authority, and that includes your doctor. Don't just accept what they give you. When I walk into that dialysis center, right, and I see what I see, I'm sickened myself. I'm disgusted, and my kidneys work, thank God. I'm disgusted because you have people who don't even have a sense of their own health care, who are handed things or not even told things, and then they're just supposed to do it and not question authority. And it's a lot. It's a lot. It's going on everywhere.
Yeah. It doesn't make you a hypochondriac. It just makes you healthy, and it makes you wise to speak up and say what's on your mind, because if it's not feeling right, it ain't right. And they have whatever this hypocritical oath or whatever it's called or whatever, they're supposed to be taking care of you. Just like the police are supposed to protect themselves. Hippocratic, whatever it is. You know what I'm saying. It's like they're supposed to do their jobs. Ensure that they do their job and take care of everybody, including black people.